yourself to settle into this moment of peace. Breathe in slowly and deeply, then release that breath with a gentle sigh. Today, we're going to talk about something that affects so many people, yet is rarely discussed with the care it deserves. How to repair a damaged skin barrier and how to do it with patience, gentleness, and compassion for yourself and your skin. If your skin barrier is damaged, first know this: it's not your fault and it's not permanent. Barriers can be repaired. Your skin wants to heal. It's designed to heal. With the right support and enough time, your barrier can return to health, and your skin can feel comfortable and resilient again. Before we dive into the how, let's understand what barrier damage looks like and how it happens, so you can recognize it and understand what you're addressing. A damaged barrier reveals itself in many ways. Your skin might feel tight and uncomfortable, even right after moisturizing. It might look dull, rough, or flaky. You might experience increased sensitivity. Products that never bothered you before now sting or burn. Your skin might be both oily and dry at the same time, producing excess sebum while also feeling dehydrated. Redness, irritation, and inflammation become more common. Your skin might react to temperature changes, wind, or even water. Healing takes longer. A simple pimple becomes a prolonged ordeal. Perhaps most frustratingly, nothing you put on your skin seems to help. Moisturizers don't moisturize. Treatments irritate. Your skin feels impossible to satisfy or comfort. This is the hallmark of barrier damage. Your skin's protective layer is compromised and can't function properly. How does barrier damage happen? Usually it's the cumulative result of well-intentioned but misguided practices. Overexfoliation is one of the most common causes. Using acids, retinoids, or physical scrubs too frequently or intensely. Harsh cleansing strips away your skin's natural protective oils. Using too many products overwhelms your skin. Environmental assault from sun, wind, cold, or pollution takes its toll. Even stress, poor sleep, and inadequate nutrition can weaken your barrier over time. Sometimes barrier damage happens suddenly. You try a new product that's too harsh. You overexfoliate in pursuit of perfect skin. You spend time in an extremely harsh climate. Other times, it's gradual, the slow erosion of your barrier through daily practices that seem harmless but accumulate into damage. The good news is that regardless of how it happened, the repair process is the same: simplification, gentleness, nourishment, and patience. Let's talk about how to repair your damaged barrier, step by careful step. The very first and most important action is to stop all potentially irritating products and practices immediately. This means pausing all active ingredients, retinoids, AHAs, BHAs, vitamin C, benzoyl peroxide, and any other treatment products. Yes, all of them, even if they're working on other concerns. Your barrier repair is the priority now because without a healthy barrier, no other treatment can work effectively anyway. Stop any physical exfoliation. Put away your scrubs, your exfoliating brushes, your rough washcloths. Stop any chemical exfoliation. Your skin needs to rebuild its protective layer, and you cannot exfoliate and repair simultaneously. Exfoliation, by definition, removes layers of skin. Right now, you need to build layers, not remove them. This pause isn't permanent. It's a temporary break to allow healing. Think of it like resting a sprained ankle. You stop running to allow healing, not because you'll never run again. The same applies here. Once your barrier is repaired, you can thoughtfully reintroduce actives if you choose. But right now, they must stop. Next, simplify your routine dramatically. Strip it down to the absolute basics: gentle cleanser, barrier repairing moisturizer, and sunscreen during the day. That's it. 3 products, maybe 4 if you want to add a barrier supporting serum, but no more. Your skin is overwhelmed and needs simplicity to heal. Let's discuss each step of your barrier repair routine. For cleansing, choose the gentlest possible cleanser. Look for cream cleansers or cleansing milks rather than gels or foams. Avoid anything with sulfates. The cleanser should be pH balanced, ideally around 5.5 to match your skin's natural pH. It should remove impurities but leave your skin feeling soft, never tight or stripped. In the morning, consider skipping cleanser entirely and just rinsing your face with lukewarm water. Your skin hasn't accumulated much overnight, and morning cleansing can be unnecessary stress on a damaged barrier. If you feel you must cleanse, use your gentle cleanser, but very briefly and minimally. In the evening, cleanse thoroughly but gently to remove sunscreen and the day's accumulation. Massage the cleanser onto your skin for about 60 seconds, then rinse thoroughly with lukewarm water, never hot. Pat your face dry gently with the soft towel. Immediately after cleansing, while your skin is still slightly damp, apply your barrier repairing products. Timing matters here. Damp skin absorbs products better, and you want to seal in that moisture before it evaporates. For the repair phase, your moisturizer is your most important tool. You want a moisturizer specifically formulated for barrier repair, ideally containing several key ingredients. Ceramides are absolutely crucial. They're lipids that form part of your skin's natural barrier structure. When you apply ceramides topically, you're directly replenishing what's been lost. Look for products with multiple types of ceramides. Ceramide 1, 3, and 6,2 are particularly important. Cholesterol and fatty acids work synergistically with ceramides to rebuild your barrier. Some advanced barrier repair products contain all 3 in specific ratios that mirror your skin's natural composition. These are gold standard for barrier repair. Niacinamide supports ceramide production, reduces inflammation, and improves overall barrier function. A concentration of 2 to 5% is ideal. Hyaluronic acid provides deep hydration, keeping your skin plump and supporting its ability to function properly while it repairs. Glycerin is a simple but effective humectant that attracts and holds moisture, supporting hydration throughout the day. Panthenol soothes inflammation and supports healing. It's gentle and beneficial during the repair phase. Apply your barrier repairing moisturizer generously. Don't skimp. Your damaged barrier needs abundant nourishment. Use enough to cover your face and neck comfortably, and don't be afraid to reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step, especially at night. Oils act as occlusives, sealing in all the hydration and barrier repairing ingredients you've just applied. They prevent transepidermal water loss, giving your barrier the best possible environment for repair. Oils rich in linoleic acid, like rosehip, hemp seed, or sunflower oil, are particularly beneficial for barrier repair. Apply just a few drops, warmed between your palms, and press gently onto your skin. During the day, sunscreen remains essential. UV damage interferes with barrier repair and creates additional damage. Choose a gentle, mineral sunscreen if possible, as these tend to be less irritating. Apply it over your moisturizer every morning. Beyond your topical routine, several environmental and lifestyle factors will accelerate or hinder your barrier repair. Humidity is your friend during barrier repair. Use a humidifier in your bedroom and anywhere you spend significant time. Moist air reduces the rate at which water evaporates from your skin, giving your barrier a chance to retain hydration and heal. This simple step can make a dramatic difference. Avoid very hot water on your face. Hot showers and face washing strip oils and damage your barrier further. Use lukewarm water only and keep face washing time brief. Protect your skin from harsh weather. Cold wind, dry air, intense sun, all of these stress your compromised barrier. When outdoors in challenging weather, protect your face with scarves, hats, or other physical barriers in addition to your sunscreen. Stay well hydrated internally. Drink water consistently throughout the day. Your barrier repair happens at the cellular level, and your cells need adequate water to function and heal.
Skin layer and are the mildest type. These use low concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16, When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。こう、広しはその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に測った午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、コウの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはコウの胸に小さな歯のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。コウは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、コウは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がネオ懐石と呼ぶスタイルだ。何の用だ。威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフボー、トックはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41 Microneedling RF and Advanced Microneedling Technologies for Acne Scarring Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42, Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin. After 1 to 2 weeks of consistent use, inflammatory acne should appear less red and swollen. After 4 weeks, you should see significant improvement in the number of inflammatory lesions. Full results typically appear after 6 to 8 weeks of consistent use. Long-term use of benzoyl peroxide is safe and very common. Many people successfully maintain clear skin for years using benzoyl peroxide as their primary acne treatment. However, some dermatologists recommend occasionally taking breaks from benzoyl peroxide, perhaps 1 week per month, to allow your skin's natural bacteria to repopulate normally. This isn't absolutely necessary, but some people find it helpful in maintaining overall skin health. One important consideration: never use benzoyl peroxide with vitamin C or niacinamide at the same time, as benzoyl peroxide can oxidize these ingredients, reducing their effectiveness. Apply these ingredients in the morning and benzoyl peroxide in the evening, or use them on different days. Guide 6: Retinoids, the gold standard anti-aging and acne treatment comprehensive guide. Retinoids represent the gold standard in skincare science, with decades of research supporting their effectiveness for acne, aging, and general skin health. Understanding retinoids' mechanism, types, concentrations, and proper use is essential for anyone serious about achieving clear, healthy skin. Retinoids are vitamin A derivatives that work through multiple powerful mechanisms. First, they increase cellular turnover, causing your skin to shed old cells and reveal fresh, new skin underneath. This prevents dead skin cell accumulation that leads to clogged pores and comedones. Second, they normalize sebaceous gland function, helping regulate sebum production. Third, they stimulate collagen production, improving skin elasticity and minimizing fine lines. Fourth, they have anti-inflammatory effects, reducing the redness and irritation of acne. Fifth, they prevent follicular hyperkeratinization, the abnormal cell shedding that contributes to acne. Sixth, they have antioxidant properties, protecting skin from free radical damage. The retinoid family includes various types at different strengths. Over-the-counter retinol is the gentlest form, requiring conversion by your skin's enzymes to the active retinaldehyde and then to retinoic acid. This multi-step conversion process makes retinol gentler but less immediately effective than prescription retinoids. Retinol, retinaldehyde, is slightly more powerful than retinol, requiring one fewer conversion step. Prescription retinoids include tretinoin, Retin-A, adapalene, Differin, and tazarotene, which are already in their active form and thus more powerful and faster acting than over-the-counter options. For someone new to retinoids, starting with over-the-counter retinol at a low concentration, 0.25 to 0.3%, is typically appropriate. This allows your skin to build tolerance gradually. After several months of consistent retinol use, you might consider asking your dermatologist about prescription retinoids for enhanced results. Retinoids are only used at night because they increase sun sensitivity substantially. UV exposure dramatically increases the risk of photosensitivity reactions and post-inflammatory hyperpigmentation. Morning retinoid use would leave your skin vulnerable to severe sun damage throughout the day. When starting retinoids, begin with a very conservative approach. Use a low-concentration retinol product just 2 to 3 times per week initially. Apply it to completely dry skin, as retinoids irritate damp skin significantly. Wait 20 minutes after cleansing before applying retinoid to ensure your skin is completely dry. Use a pea-sized amount for your entire face. Retinoids are potent and a little goes a long way. During the first 4 to 12 weeks of retinoid use, expect a retinization phase characterized by redness, peeling, flaking, and sometimes temporary worsening of acne. This is normal and doesn't indicate that retinoids aren't appropriate for you. This phase typically lasts 2 to 8 weeks and gradually resolves as your skin adapts. Many people who discontinue retinoids during this phase miss out on their incredible long-term benefits simply because they couldn't tolerate the short-term adjustment period. Managing retinization involves strategic moisturizing. Use your retinoid, then wait about 20 minutes, then apply a hydrating moisturizer over top. Some people layer their moisturizer directly on top of wet retinoid serum, which dilutes the retinoid slightly and reduces irritation. This is called the sandwich method. This method is appropriate when dealing with significant irritation. As your skin adapts, you can gradually stop using the sandwich method. Never combine retinoids with other strong actives initially. Using retinoids with benzoyl peroxide, salicylic acid, or chemical exfoliants on the same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. Starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7: Hormonal Acne in Women, Causes, Recognition, and Comprehensive Medical Management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks. Hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, Stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods.
Welcome, and breathe with me. Today we're discussing something many people know they should do but struggle with: reapplying sunscreen throughout the day. You apply sunscreen in the morning carefully and thoroughly. You feel protected. But as the hours pass, that protection diminishes. Sunscreen breaks down, wears away with sweat and touch, and gradually loses effectiveness. Reapplication isn't optional, it's essential for continued protection. The standard recommendation is to reapply every 2 hours of sun exposure. This isn't arbitrary. Studies show that most sunscreens, even water-resistant ones, lose significant effectiveness after 2 hours of continuous UV exposure. Chemical sunscreens break down as they absorb UV radiation. That's literally how they work. They absorb rays and convert them to heat. But this process gradually degrades the active ingredients, reducing protection over time. Physical sunscreens are more stable, but they can still rub off, be diluted by sweat, or settle into skin creases, creating gaps in coverage. Additionally, most people don't apply enough sunscreen initially. We use 25 to 50% of the recommended amount, meaning our actual SPF is much lower than the bottle claims. Reapplication helps compensate for this initial underapplication, so reapplication is crucial. But how do you actually do it, especially over makeup in the middle of your day? Let's explore practical reapplication strategies for different situations. If you're bare-faced or wearing minimal makeup, reapplication is straightforward. Gently blot away excess oil with blotting paper if needed. Apply your sunscreen just as you did in the morning. A generous amount massaged gently into your skin. Let it absorb briefly before resuming activities. Keep a tube of your favorite sunscreen in your bag, car, or desk drawer. Make it accessible so reapplication becomes easy and automatic. But what if you're wearing full makeup? This is where reapplication gets tricky, but remains important. Powder sunscreens are designed for reapplication over makeup. These are loose or pressed powders with SPF that you can dust or pat over your makeup without disturbing it. They provide a quick protection boost and can even mattify shine. However, be realistic about powder sunscreen limitations. It's difficult to apply enough powder to achieve the labeled SPF. Think of it as supplemental protection rather than complete coverage. It's better than nothing, but not quite as effective as cream reapplication. To use powder sunscreen effectively, apply generous amounts, more than feels natural. Use a kabuki or powder brush for loose powder or the provided puff for pressed powder. Press and roll the powder onto your skin rather than sweeping it. Focus on high exposure areas, forehead, nose, cheeks, and chin. Sunscreen setting sprays are another option for makeup wearers. These are mists containing SPF that you spray over your face to refresh protection. Like powder sunscreens, they're convenient but have limitations. The challenge with spray sunscreens is application control. It's hard to know if you've applied enough, and much of the product can drift away rather than landing on your skin. You also need to ensure even coverage. If using sunscreen spray, close your eyes and mouth. Hold the bottle 6 to 8 inches from your face. Spray generously in a continuous motion, covering your entire face. Then pat it gently with clean hands to ensure even distribution. Spray in a well-ventilated area and avoid inhaling the mist. Sunscreen sticks offer another convenient reapplication method. These solid balms in stick form allow you to swipe sunscreen over makeup without using your hands. They're portable, mess-free, and easy to apply targeted protection to high-exposure areas. Apply sunscreen sticks in multiple layers, swiping back and forth several times to build adequate coverage. The portability makes them perfect for tossing in your purse or pocket. Some people prefer to remove makeup, Reapply cream sunscreen, then touch up makeup. This ensures the most thorough protection but requires more time and effort. If you're outdoors all day, at the beach, park, or outdoor event, this might be worth doing. For those working indoors with limited sun exposure, reapplication strategy can be more relaxed. If you're inside with minimal window exposure most of the day, one morning application might suffice for typical daily life. But for any extended outdoor time, even a lunch walk or afternoon errands, reapplication matters. If you work near windows or have significant UV exposure indoors, reapplication remains important. UVA rays penetrate glass, and chronic exposure adds up to premature aging and skin damage. Consider your individual sun exposure when determining reapplication frequency. Continuous outdoor exposure requires strict 2-hour reapplication. Intermittent sun exposure, being outside briefly throughout the day, might not require such rigid timing, but you should still reapply if you'll be outdoors for extended periods. Water activities demand more frequent reapplication. Even water-resistant 80-minute sunscreen should be reapplied immediately after swimming, toweling off, or heavy sweating. Water-resistant doesn't mean waterproof. The sunscreen will gradually wash away. If you're swimming or sweating heavily, reapply every 40-80 minutes depending on your sunscreen's water resistance rating. Better yet, be conservative and reapply frequently. You can't over-apply sunscreen when you're in the water. For outdoor activities like hiking, sports, or yard work, reapply every 2 hours minimum or more frequently if you're sweating heavily. Keep sunscreen easily accessible so you remember to reapply. Let's discuss specific body areas that need reapplication attention. Your face, neck, ears, and chest are usually well covered by morning application and reapplication. But people often forget their hands, forearms, and any other exposed skin. Hands in particular need frequent reapplication. We wash them multiple times daily, removing sunscreen each time. Apply sunscreen to the backs of your hands after washing them, especially if you'll be driving or spending time outdoors. If you're in the car frequently, you might want to keep a small tube of sunscreen in your car for easy hand and arm reapplication before driving. Left side sun damage from driving is real and cumulative. The scalp is another often forgotten area. If you have thinning hair or a receding hairline, protect your scalp with hat, sunscreen spray, or powder sunscreen designed for hair scalp use. Let's address the mental and habit-forming aspects of reapplication. The biggest barrier isn't logistics. It's remembering to do it and overcoming the inconvenience. Set alarms on your phone if you'll be outdoors for extended periods. A 12 p.m. and 2 p.m. reminder can prompt midday reapplication. Build reapplication into existing routines. Reapply after lunch or when you take an afternoon break or before leaving work if you'll be driving with sun exposure. Keep multiple sunscreens in different locations: your purse, car, office desk, gym bag. Accessibility removes excuses. Choose reapplication products you genuinely like using. If your powder sunscreen feels nice and looks good on you, you'll use it. If your sunscreen stick has a pleasant texture, reapplication becomes less of a chore. Welcome and take a calming breath. Today we're going to demystify something that confuses many people: skincare ingredient lists. Learning to read and understand product labels empowers you to make informed choices about what you put on your skin. Looking at an ingredient list can feel overwhelming. There are long chemical names, unfamiliar terms, and dozens of ingredients in a single product. But with some basic knowledge, you can decode these lists and understand what you're actually applying to your skin. Let's start with how ingredient lists are structured, because this gives you immediate valuable information. In most countries, including the United States, ingredients must be listed in descending order by concentration. The first ingredient is present in the highest amount, the second ingredient is second most abundant, and so on. This continues until you reach concentrations below 1%, at which point ingredients can be listed in any order. This means the first 5 to 7 ingredients typically make up the bulk of the product's formula. These are the ingredients that will have the most impact on how the product performs and how your skin responds to it. Let's look at a hypothetical ingredient list: water, glycerin, cetioaryl alcohol, niacinamide, hyaluronic acid, ceramides, preservatives, fragrance. Water is the first ingredient, meaning this is primarily a water-based product. Water is an extremely common base for skincare products. It's inexpensive, a good solvent for many ingredients, and helps products spread easily. Glycerin is second, which tells you this is a hydrating product. Glycerin is a humectant that attracts moisture to your skin. Cetioaryl alcohol is third. Despite the name alcohol, this is actually a fatty alcohol that acts as an emollient and thickener. It's moisturizing, not drying. Don't confuse fatty alcohols like cetioaryl alcohol with drying alcohols like denatured alcohol or SD alcohol. Niacinamide appearing fourth means it's present in a meaningful concentration. This product will likely provide niacinamide's benefits: calming inflammation, regulating oil, fading dark spots, and strengthening your barrier. You can see how reading even just the first few ingredients tells you a lot about what the product is and what it's designed to do. Now let's discuss categories of ingredients and what to look for. Humectants attract and hold water. These are crucial for hydration. Common humectants include glycerin, hyaluronic acid, sodium hyaluronate, aloe vera, honey, panthenol, provitamin B5, and propylene glycol. If you want a hydrating product, look for humectants high on the ingredient list. Emollients fill in the spaces between skin cells, creating smooth, soft skin and helping repair your barrier. Common emollients include ceramides, cholesterol, fatty acids, squalane, jojoba oil, shea butter, and various plant oils. If your skin is dry, rough, or sensitive, emollients should be prominent in your products. Occlusives create a protective layer on your skin surface that prevents water loss. Common occlusives include petrolatum, mineral oil, dimethicone, beeswax, and lanolin. Very dry skin benefits from products with occlusives, especially at night. They're the seal that locks in all the hydration and treatment ingredients beneath them. Antioxidants protect your skin from free radical damage caused by UV exposure, pollution, and normal metabolism. Common antioxidants include vitamin C, L-ascorbic acid, ascorbyl palmitate, magnesium ascorbyl phosphate, vitamin E, tocopherol, niacinamide, vitamin B3, green tea extract, resveratrol, and coenzyme Q10. Look for antioxidants in daytime products, especially when your skin faces environmental stressors. Exfoliants help remove dead skin cells and improve texture. We have AHAs like glycolic acid and lactic acid, water-soluble surface exfoliants, BHAs like salicylic acid, oil-soluble, penetrates pores, and enzymes like papain and bromelain, gentle protein dissolvers. Exfoliants typically appear lower on ingredient lists because they're effective at low concentrations, usually between 0.5% and 10%. Retinoids increase cell turnover, boost collagen, and prevent clogged pores. You might see retinol, retinol palmitate, retinaldehyde, or if prescription, tretinoin. These are powerful ingredients that appear effective even at low concentrations. Peptides are chains of amino acids that signal your skin to perform certain functions, often related to collagen production. Look for matrixyl, copper peptides, palmitoyl pentapeptide, and various other peptides. The science on peptides is still evolving, but many people find them helpful for firmness and texture. Now let's talk about ingredients you might want to avoid or be cautious with. Fragrances can cause irritation and allergic reactions. Fragrance is one of the most common causes of contact dermatitis. If you have sensitive skin or are prone to reactions, fragrance-free products are safer. Note that fragrance or parfum on an ingredient list can represent dozens of different chemicals, and companies aren't required to disclose what specific compounds they're using. Natural fragrances from essential oils can also be irritating, despite being natural. Citrus oils, peppermint, eucalyptus, and many others can cause sensitivity. Natural doesn't automatically mean gentle. Drying alcohols like alcohol denat, SD alcohol, and isopropyl alcohol can strip your skin and cause irritation, especially in high concentrations or with prolonged use. However, small amounts in a formula might not be problematic, and they serve purposes like helping products dry quickly or penetrate better. Context and concentration matter. Sulfates like sodium lauryl sulfate, SLS, and sodium laureth sulfate, SLES, are cleansing agents that can be harsh and stripping, especially for dry or sensitive skin. Many people prefer gentler cleansing agents like cocamidopropyl betaine or sodium cocoyl isethionate. Parabens are preservatives that prevent bacterial and fungal growth in products. They've been controversial due to concerns about hormone disruption, though research hasn't definitively proven harm at the concentrations used in cosmetics. If you prefer to avoid them, many products now use alternative preservatives like phenoxyethanol or sodium benzoate. That said, preservatives themselves are important. Products containing water need preservatives to prevent dangerous bacterial and mold growth. Preservative-free products must be packaged carefully in airless pumps and used quickly after opening. Let's discuss concentration. An ingredient appearing on a label doesn't guarantee effectiveness. Concentration matters tremendously. For instance, if vitamin C appears near the end of a long ingredient list, it might be present only in trace amounts for marketing purposes. This is sometimes called fairy dusting, adding trendy ingredients in tiny amounts that won't actually provide benefits just so they can appear on the label. For key active ingredients, you want to see them high enough on the list to indicate meaningful concentrations. If you're buying a niacinamide product, niacinamide should appear within the first 7 ingredients or so, not tucked away at the end. Effective concentrations vary by ingredient. For example, niacinamide is effective at 2 to 5%, vitamin C at 10 to 20%, retinol at 0.25 to 1%, and hyaluronic acid at 0.1 to 2%. You often can't tell exact percentages from ingredient lists, but position gives you a hint. Let's talk about buzzwords and marketing claims because these can be misleading. Clean beauty has no legal definition. What one brand calls clean might differ entirely from another brand's definition. Clean doesn't automatically mean safer or more effective. Judge products by their actual ingredients and how they perform for your skin, not by marketing labels. Natural and organic also aren't automatically better. Some natural ingredients are wonderful for skin. Others can be irritating or ineffective. Some synthetic ingredients are extremely effective and safe. What matters is how an ingredient works for your skin, not whether it came from a plant or a lab. Dermatologist tested sounds impressive, but means very little. It might mean one dermatologist used the product once. It doesn't guarantee effectiveness or safety. Similarly, clinically tested can mean almost anything. The testing might have been minimal or poorly designed. Hypoallergenic suggests a product is less likely to cause allergic reactions, but there's no standard for this term. It's largely marketing. If you have allergies, check the actual ingredient list. Non-comedogenic means less likely to clog pores, but again, there's no standard testing or definition. What clogs pores can be individual. An ingredient that's fine for you might cause breakouts in someone else. Let's discuss how to approach trying new products safely. First, identify your skin's sensitivities. If you know certain ingredients cause reactions, check labels carefully and avoid products containing them. Keep a note in your phone of ingredients you react to so you can reference it when shopping. Second, patch test if you're concerned about reactions. Apply a small amount of the new product to your inner forearm or behind your ear and wait 24 to 48 hours. If no reaction occurs, try it on a small area of your face. If all is well after a few days, proceed with full use. Third, introduce one new product at a time and wait at least a week before adding another. This way, if you have a reaction, you'll know which product caused it. Fourth, remember that expensive doesn't mean better. A drugstore product with good ingredients can work just as well as a luxury product. Judge products by their formulations, not their price tags. Reading reviews can be helpful, but take them with perspective. Skincare is highly individual. A product that's life-changing for one person might break out another person. Reviews can indicate general quality and experience, but your own skin is the ultimate judge. As we close our time together, remember that becoming ingredient savvy is empowering. You don't need to memorize every chemical name or become a cosmetic chemist, but understanding the basics, how to read an ingredient list, what major categories of ingredients do, what to look for, and what to be cautious of, helps you make informed choices. Your skin deserves products that truly serve its needs, not just products with clever marketing. By learning to read labels, you become a more informed consumer and a better advocate for your own skin health. Take a deep breath in and out. You now have the tools to decode ingredient lists and choose products wisely. May you find products that truly benefit your skin. May you feel empowered in your choices. May you trust your growing knowledge and your skin's feedback. Thank you for this time together. Be well and choose wisely.
Other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. Erbium YAG fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, Erbium YAG is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma, PRP, therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive. Laser treatments $500 to $1,500 per session, multiple sessions required. Microneedling is more affordable at $200 to $400 per session. Fillers vary based on amount needed. Insurance typically doesn't cover cosmetic scar treatment. Discussing cost with your dermatologist and potentially planning treatment over time is reasonable. Home care between professional treatments supports improvement. Proper sun protection prevents hyperpigmentation that makes scars more noticeable. Hydration and appropriate skincare supports skin healing. Some evidence suggests that certain topical ingredients like retinoids and vitamin C might provide modest scar improvement through collagen support, though these effects are minor compared to professional treatments. Scar appearance often improves naturally over years. Post-inflammatory changes gradually fade. Scars that seem severe initially might improve significantly over 12 to 24 months even without treatment, though active treatment accelerates improvement. Guide 32. Environmental and occupational factors influencing acne. Acne development isn't purely internal. Environmental and occupational factors significantly contribute to breakouts. Understanding these external factors allows you to modify your environment and workplace practices to support clearer skin. Heat and humidity increase sebum production and promote bacterial growth, worsening acne. People living in tropical climates or hot, humid environments experience more significant acne than those in cool, dry climates. While you can't change your climate, understanding that heat worsens acne helps you implement compensatory strategies. Increase air conditioning use if possible. Use a humidifier in dry climates to prevent the skin barrier compromise that can paradoxically worsen acne. Keep skin cleaner during hot, humid times when sebum production is highest. Sweating creates moisture that promotes bacterial growth in pores. Athletes or people with active occupations experience acne worsening related to sweat. The solution is simple: shower immediately after sweating, change into clean clothes, and avoid touching your face during exercise. Exercise itself is beneficial for stress reduction and hormonal balance, so don't avoid it, just manage post-exercise hygiene properly. Friction from tight clothing, athletic equipment, or repetitive face touching, occupational hand-face contact, can trigger acne. Friction acne appears where contact occurs, under helmet straps, where backpack straps compress skin, on the jawline from phone contact. Wearing loose, breathable clothing, ensuring equipment is clean, and avoiding touching your face helps prevent friction acne. Occupational chemical exposure contributes to acne in certain professions. Workers in automotive, petrochemical, or metalworking industries' exposure to mineral oils, cutting fluids, and other chemicals experience